Imagine feeling an electric shock across your face when you are brushing your teeth or you are eating. This is what people with trigeminal neuralgia actually face. So today we'll be talking about what trigeminal neuralgia is, its causes, its symptoms, its management, and what you should look out for. Hi guys, welcome back to this channel. This is Dr. Asiya, and as usual, we'll be breaking down common health conditions. The trigeminal nerve is responsible for sensations in the face, around the forehead and the eyes, the cheeks and the jaw. So trigeminal neuralgia is a chronic pain that affects this trigeminal nerve. So this pain is really described as an electric shock kind of pain, a burning kind of pain, sharp and intense. It mostly affects one side of the face, but sometimes it can actually affect both sides of the face. But the thing is, if it affects both sides of the face, it happens one after the other, meaning one side will first of all experience the pain, then the other side will experience the pain next. So this pain starts so suddenly and it can last for a few seconds to about 2 minutes. And it's quite excruciating. The pain may happen repeatedly throughout the day. In trigeminal neuralgia, even normal activities can trigger the pain. Maybe when you are brushing your teeth, when you are chewing, when you wash your face. Sometimes even a gush of wind can actually trigger the pain. Even sitting under an air conditioner can actually trigger the pain. Some people are even afraid of brushing their teeth or eating because they are so scared of the pain. So they'll rather avoid the pain than to eat or to brush their teeth. It is that bad. The cause of this trigeminal neuralgia, it's when a blood vessel is actually pressing on the trigeminal nerve in the brain. That is the major cause. But there are other things that could also be linked to it. For example, conditions like multiple sclerosis, trauma to the brain, injury, or even as a result of stroke. Who is most at risk? Trigeminal neuralgia is actually more common in women than in men. It's also more common above the age of 16, although it can also affect the younger generation. Researchers have seen studies that it has affected people at the age of 29, 30, 31, 32. So it's not necessarily linked to age, but age could also be a risk factor. People with high blood pressure, diabetes, basically anything that can actually narrow the blood vessels. Remember, the blood vessel compressing on the nerve is the cause of trigeminal neuralgia. How can this be diagnosed? Your symptoms, the history you present to your doctor, and an MRI to see where exactly the compression of the trigeminal nerve is happening. Then, what are the management options? It's a bit broad, but let's dive into it. Treatment is actually of two types, with medications and also surgical. Medications, there are a group of medications called anticonvulsants. These can help calm the nerve. Examples of these are carbamazepine. Then there's another one known as the muscle relaxants. Example of this is baclofen. So these medications are usually given to help manage symptoms. It's not like it is actually curing it per se. It's just to help the person live a normal life. Because imagine you are scared to eat, you are scared to brush, you are scared to even wash your face. It's going to have an impact on your mental health without you even realizing it, either subconsciously or consciously. So the medications will help you to actually live a normal life and do your day-to-day activities without having to deal with this pain consistently. Moving on to the surgical management. One of the surgical management is known as microvascular decompression. It's when they try to locate the blood vessel in the brain that's compressing it and relieve that compression. So it's a surgical process whereby they'll have to open up the skull to do that. There's another one known as radiosurgery. Is done using radio frequency to decompress the blood vessel. Then we have the last one, which is the rhizotomy procedure. In rhizotomy, the surgeons destroy the nerve fibers so that it can reduce the pain that the patient experiences. It can be done through injection or a balloon, and it's done with a neurosurgeon and also a radiosurgeon. Living with trigeminal neuralgia can actually be difficult. It might affect your interactions with friends and family, even your productivity. It can also even cause one to have depression because it can also cause you to have anxiety, affecting your quality of life just because you are tired of experiencing the pain and you have that fear of you when next will the pain come. You don't even know when next is going to appear, when next is going to come up. So that's totally understandable. But there are ways to actually help you to put you in remission. So when should you seek a doctor's help? Seek help when you experience an electric light shocking kind of pain, when this pain becomes persistent over time, when it repeatedly happens, and when your normal daily activities are triggering the pain. Yes, living with it is not easy, but early diagnosis will provide a better outcome. So if you or someone you know experiences something like this and they are confused, please share this video with them and let them know the next step to take. Let me know in the comment sections what questions you have and what topics you would like me to talk about next. Do not forget to like, subscribe, and share with friends and family. See you in the next one.